We've come from Alice Springs, so we've been here, I don't know, it must be about 2 months, I think. I'm here with Les because he's found some lumps in his neck, in the lymph glands.
Yes, the cancer that I have is a prostate cancer, and it was diagnosed to be in the lymph system 9 years ago.
Well, I've been here for 2 weeks, and I'm from Alice Springs. Well, unfortunately, he's got cancer of the stomach, which was detected in Alice Springs, and at the moment we're just waiting for him to be taken back to Alice Springs by a Royal Flying Doctor and put into palliative care.
I come from Darwin. I've been here 5 weeks. The sort of cancer that I've got is breast cancer, and I'm down here to have radiation therapy because there isn't a radiation oncology unit in Darwin.
I'm from Port Lincoln, and we've been using the facility now for probably over a month. This is probably our third visit to Flinders Lodge. The cancer that I have non-Hodgkin's lymphoma.
Flinders Lodge is our home at the moment, and all the things that encompasses. So it's not just a place where we eat and sleep, it's the place where we discuss what's going on, it's the place where we have friends come to visit. More than just the motel room, it really is our home.
The people who use Flinders Lodge are the people from the country who are having cancer treatment in metropolitan Adelaide. So people from South Australian country areas, as far away as Darwin in Northern Territory, and across the border sometimes from Broken Hill.
The biggest reason for coming to Flinders Lodge for me was that its location. It's close to town, I can walk to the hospital every day. It's wonderful, as you can see, a wonderful area to live, it's to stay for 6 weeks. And it has a good reputation. It has a reputation of being very friendly, a bit of a home away from home.
Well, while I'm in Adelaide, I have stayed at the nurses' quarters, which are very good. For 1 or 2 nights is fine, but it doesn't naturally hold a candle to here. With my husband, when he's unwell, is the fact that he knows I'm safe. He knows that I'm in good accommodation. He now knows that it's a situation where I've met lots of beautiful people.
The cost for people coming to stay at Flinders Lodge is provided by the Commonwealth Government through the PAT scheme, the Patient Assisted Transport scheme. So they pay for that through the scheme. So in fact there is no cost to people coming to Adelaide for cancer treatment when they stay in our motels.
So the thing that Flinders Lodge provides for me is company. As you said, you leave your family behind and you're on your own, you're scared, you don't know what's ahead of you, you don't know how you're going to cope with your treatment. And so you've got the opportunity to meet other patients who are going through similar treatment themselves, and it is comfortable, it is your home away from home, and the staff are wonderful, absolutely wonderful. You've got to feel comfortable, you've got to feel safe, and Flinders Lodge does that.
You wouldn't find anywhere better, particularly for people from the country. And the 2 weeks has flown. I've met wonderful people. The staff are great. And it's just made things so much easier.
We found it has been really good to be in this environment, to be able to talk about what's going on in the real world, which is a step outside of the world that we're living in at the moment.
Flinders Lodge provides us with so much. We've met so many people that I think because we're all in the same boat, we're all here for hospitalised reasons, we're all either a patient or a carer, and we're all looking for a familiar, friendly face and somewhere to meet and someone to talk to.
And it was in a great location to provide facilities for people from the country having cancer treatment, but it was in a poor state of repair. So it needs quite a lot of work to upgrade those facilities so that when people from the country are having cancer treatment, they can recuperate in a nice environment. Recreation facilities for people having cancer treatment are really important, not only for them, but for also the people, the carers that come with them. It just provides a different environment to stop them thinking so much or continually about their cancer treatment and their ill health. So it's a fantastic opportunity for people to forget for a little while about why they're here.
I just think if Flinders Lodge was renovated to include a recreation room, it would just be a wonderful thing.
So yeah, that's probably the biggest thing that's missing here is we just don't have a room where people can get together and meet each other and talk to each other. And because you don't know anybody, you're reluctant to go and knock on someone's door and say, "Hey, I'm here, please come and talk to me because I'm on my own and I need some support."
For me personally, it would give me somewhere else to go sometimes if Les was having a rest or if Les needed to be doing his thing in the room. I could feel that I could go somewhere else.
The renovation of the recreational facilities is important, basically because it is a meeting place for patients and their carers, and it's a way that we can all congregate together and catch up, show support.
It'd be an extension of us sitting out in the balcony or outside our rooms with a cup of coffee. It would be great for mums or dads with young kids, even teenagers.
I just think that it would bring its own value and we would all get used to using it in our own ways. But set up well and used well, the possibilities are endless.
We have a very thick facilities plan now that shows all of the areas that require refurbishment and improvement. The recreation room is one of those areas, and this is a great opportunity for the community to support the renovation of the rec room.